Deep venous thrombosis is essentially a blood clot that forms in one of the deeper, larger veins of the body. It can be dangerous depending on the location, and the main risk of it is that part of the clot could break off and go up to the lungs and cause a pulmonary embolism. The symptoms of DVT can range from leg swelling to arm swelling if it's in the upper extremity, to pain in the calf, or some slight color change in the legs, like a bluish color. The main patients at risk are those with a history of clotting, patients with cancer are at higher risk of forming blood clots, and patients with a strong family history of blood clot. Remain active and know if you have any family history of clotting. And if you have a clotting disorder, then taking your medication as instructed. Most common treatment for DVT is a short course of anticoagulation or blood thinner. Patients that have had recent episodes of bleeding or major surgery and at higher risk of bleeding, things like recent head bleed or bleeding in your GI tract. Essentially, patients that are unable to safely take blood thinner without having a high risk of bleeding, we don't put on blood thinner or anticoagulation. The treatment options for DVT really depend on the symptoms. If you cannot receive blood thinners, but you have DVT at risk of having a pulmonary embolism, sometimes we put in special filters called IVC filters that are temporary and can be removed when you're no longer at risk of pulmonary embolism.